CPT JJ CPB Introduction 14, or page 14, part 5.
Guidelines.
This is the start of, we're going to review a little the guidelines, okay?
Specific guidelines are presented at the beginning of each of the sections.
Yeah, there's, how many sections? 6, I think, right?
Yes.
E and M, there's radiology, what else?
There's a pathology.
Pathology and lab.
There's surgery.
Surgery, medicine.
Anesthesia.
Anesthesia and medicine.
Yes.
All right. So before each of these sections, there are guidelines. So if you are doing a problem in that section and you're not too familiar with the section, then read the guidelines first, because the guidelines are specific for that section, right? What's the second thing?
Okay. These guidelines define items that are necessary to appropriately interpret
And report.
the procedures and services contained in that section.
Right. These guidelines are specific for this section, like how you call things or procedures, right? Specifically for this section, right? So if you are coding something in the particular section, read the guidelines first, okay? That's what they're saying. And for instance, in the guidelines for E&M, or evaluation and management, we find these decision tree, right? How to decide whether a patient is new or established, right? So there's a bunch of questions to follow. Has the patient received any professional services from the same physician or another physician in group of the same specialty within the last 3 years? If the answer is no, then that's a new patient. If the answer is yes, you ask another question. Was that the exact same specialty? If the answer is no, that's a new patient. If the answer is yes, you answer another question. Was it the exact same subspecialty? If the answer is no, that's a new patient. If the answer is yes, then it's an established patient. Okay? So, for established patient, you have to have seen a physician in the last 3 years with the same specialty and same subspecialty. That's basically what it says. This is an example of a guideline for an EMN, or evaluation and management section, which means determining whether it is a new patient or an established patient, okay? So that's our theory for today. Now let's do a problem. So ready, set, go. Okay, this is the code of the problem. CPT JJ RVA 267-135, and we consider this a level 0, which means a very easy problem to do. And the title is
Laser surgery, cataract.
Laser surgery, cataract, right? Okay, the problem reads like this.
Surgery, eye and ocular adnexa. Patient returns to the physician's office complaining of obscured vision. Patient has had cataract surgery for 6 months prior. Patient requires laser dissection of decision of secondary cataract.
Cataract, okay? All right, so I'm going to read the problem again. It's a surgery section on the CPT code. Is the eye and ocular adnexa. The patient returns to the physician's office complaining of obscured vision, probably because he has cataracts, right? The patient has had cataract surgery 6 months prior, but now the patient requires laser decision of secondary cataract, okay? So that's the procedure. Now we're going to count to 3, so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 66821. Okay, 66821. You got that? If you got it, congratulations. If you didn't get it, let's give you a tip. Okay, the tip number 1 is
Discission is an incision of the lens of the eye for removal of cataract. Therefore, a surgery. Right.
Decision, we just explained to you what it is, so you will know how to go. Decision is an incision of the lens of the eye for removal of a cataract, and that, of course, is a surgery. So the tip number 2 is?
So start with laser surgery.
Laser surgery, okay? So that's what they're talking about, laser surgery, okay? So that's our tip, and the answer you already know is 66821, but now we're gonna count to 3, so you can pause the video and give us the path to find this answer. Okay, so 1, 2, 3. All right, this is the summary of the whole problem. It says surgery section of the CPT code is the eye and ocular adnexa. The patient returns to the physician's office complaining of obscure vision. The patient has had cataract surgery 6 months prior. The patient requires laser discission of secondary cataract. Okay, so there's only one code, and the code 1 through the index is found like this.
You go to first the index.
The index, yeah, right. And then you look for?
Laser surgery.
Laser surgery. And then?
Cataract.
Cataract, right? And you find a code. What's the code?
66821.
Okay, now what we're going to do is we're going to check this code in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Go to the tabular.
Then you start with 66821.
You start with the code that you found in the index, which is 66821, and you read that. What does it say?
Discission of secondary membranous cataract laser surgery.
Which is exactly our problem, right? So that's why there's an equal sign at the end, which means we double check this code. So that is the answer. So the answer is 66821. It's very easy. That's why we consider this a level 0 exercise, which means that if you're just starting with CPT coding, this could be one of the problems that you start doing, okay? All right, thanks for watching, and don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
In the red rectangle that says subscribe, right? And what do they get?
You will get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so don't forget to visit our website and subscribe. Thank you.
Goodbye.
Bye.